welcome, and conjani to our guest. I'm Mr. Adams,
En ek is Jayde September.
and you are tuned into the Plain Talks. Today we have our very first guest that was on our show, Miss Herman, Miss Colleen Herman. Welcome.
Hi, thanks, Houston, and thank you, Jayde. And thank you to the Plain Talks crew for having me back today.
So today we're going to speak about health screening and what is it all about and how and why is it important. So Auntie Colleen, can you tell us about more about health screening?
Okay. Okay, so the importance of a health screening. So health screenings is basically exactly what it says. It's to be screened, a full body systems, all system screening. And the reason why it's important is because once you check, you do an assessment, you'll be able to detect something early if there's something abnormal. You'll also be able to treat earlier if there is something picked up earlier. You also develop a relationship with your healthcare provider, and if necessary, you can make lifestyle changes. So health screenings, health assessments at any medical practitioner or health facility is super important.
Oh, super important. Now we know it.
So Auntie Colleen, how did this all come about?
So health screenings, obviously, it's international and everybody does it. And my approach, so I'm a nurse, as you all know, and my approach to health screenings, or let's say nursing, it's a systems approach. So we look at the system, the whole body, and you start, and I've got a small acronym that I'd like to share with you guys around how we assess and how we screen. And this acronym is called GIG. You know, when you say, I'm going to the club for a gig, or I'm going here for a gig. So I want to change that phrase and use GIG in a way to remember how we do health assessments. So let's say we'll use the systems approach now. The first G would be for general. So when you do general health assessments, you would go to the medical practitioner or the health practitioner, and you firstly would do an assessment of who you are, what you look like. We'll take your history. So we look at your individual history and we'll look at your family history, knowing that a lot of illnesses are lifestyle illnesses, and then there are some illnesses that you'll get passed down, you know, in family groups or exactly. So so family history is important, where you work, your occupation, what you're exposed to, what medication you're using. So the first part of any health screening or health assessment is a very good, very detailed history. So that's where we start with. And then following that, still under the first G, I would say you would do the BMI. I don't know if you guys know what a BMI is.
Body mass index.
Exactly.
Yeah.
So you'll do the BMI. So for a BMI, you'll weigh the person and you'll check the height. And there's a range or a rate and you get a number.
Yes.
So based on your BMI, we'll know if you are pre-obese, obese, normal, abnormal, all of that. So that's a range. So then following the BMI, we'll also do, so still under the first G of general. So we'll do, we'll check the weight and height, I said, and we'll also check, let's start by the head, we'll check your skin. So especially our very pale skinned people, we would encourage you to check regularly, at least once every second year, if there's a family history of skin cancer. We'll also check the eyes, so you'll do an eye assessment, see if there's a need for glasses. From a certain age, you'll need to check every second year. So we'll check the eyes, we'll check the ears, if there's too much wax. You know, some people clean with earbuds and that's discouraged. Yeah, because we can damage the eardrum. So then we'll check the ears, and then we'll check the mouth. So you need to visit a dentist at least every second year. Once a year if you can, but obviously we know we must change your toothbrush every 6 months. But at least visit a dentist as often as you can. So that's the dental check. And then still part of the systems of the general, we'll check your heart. So we'll check for blood pressure, we'll check your cholesterol, we'll check your glucose. So, and for those, we'll prefer to do initially just checks, and if there is something, we'll do bloods. And so for that, we'll arrange for you to come back for fasting bloods. We'll be able to see if you're hypertensive, maybe not you guys in your age range right now, but especially from 35 and older, we'll be able to see if you've got high blood pressure, if you've got diabetes, if you've got, and that coupled with your lifestyle and coupled with your family history, the healthcare practitioner will be able to make a diagnosis. We'll also check the urine. So there's a whole range of systems that we are able to assess just under the general part of the screening.
Yo, that's a lot that you guys have to go through. And
I
check
know.
But I know it's all in the process, from preventing certain diseases that that can save your life in the future. So it's kind of amazing, eh?
Yes, it is.
I think I need to get me one. Go for a checkup.
So, Auntie Colleen, you said the G stand for general. So, would you like to tell me about the I?
Yes, okay. So the I, like I said, this is, we're changing gig into, so we're using this acronym. So the I is infectious diseases. So for infectious diseases, we would list under the HIV, under screening for infectious diseases, we would encourage you to do an HIV test. So we all know HIV is topical, HIV is prevalent. In some communities, you'll see more of it and that kind of thing. So we encourage people to have an HIV test every 6 months at least. And then also part of the health assessments in the infectious diseases, we'll look at STIs. And so there's a simple screen for STIs. Our province, we look at syndromic. So we look at symptoms. We will ask the patient questions around any symptoms around STIs. So that's important. Under infectious diseases, even though it's not an infectious disease, we would encourage you also to have a flu vaccination. I know with winter approaching and coughs and colds are around with everybody, we would encourage people to have the flu shot. So the flu vaccinations are per area, and they'll look at what's coming into an area, what kind of infections, and then they'll give you a flu vaccine, which should cover most of the influenza at least, and prevent you from getting it very bad.
So when is it the best time to get a flu vaccination before like winter, so you can prepare yourself?
So I would say now, like right now, after the show, go get a flu vaccination. So right now is a good time before the winter season. We've been very dry in Cape Town this season, and our winter has been late. So now is still a good time to get a flu vaccination, and it just helps you. It takes the edge off. It doesn't mean you won't get influenza. It just means that you may not get it as bad, especially for the aged. And so some people really get sick and they're really down and out with a cold. So even doing a screening just for that and just getting a vaccination, so that for me would be under the I, under the infectious diseases, yeah.
Guys, that is all from Nurse Herman for our first segment. So stay tuned because we will be back with our second segment.